Another new technique that has come about would be what's called a no drain tummy tuck, or a more technical term for it is the use of progressive tension sutures. So when a person has a tummy tuck, essentially the skin is lifted up off the muscles, which are tightened. The skin is pulled down, the extra is removed, but there's a space that's been created by lifting the skin. If you don't do something to that space, fluid will collect in it. So the vast majority of plastic surgeons, and what used to be done would be elastic drains are placed, which go to little bulb suctions, and they evacuate the fluid so it doesn't collect. And those will stay in for 10 days, a week to 2 weeks maybe, and they're cumbersome and a nuisance and they hurt, and so they're just not very fun. So about 2007, I started to do what's called a no drain technique, and essentially what that does is lift the skin up, fix the muscle just like a regular tummy tuck, but then when you're removing the skin from the undersurface, you essentially just sew the skin and fat back down to the muscle with multiple stitches, closes off this space, number one, minimizes the tension at the incision because the tension is spread over the abdomen, so there's no tension at the incision, which means less scarring. And patients are just much happier not having to deal with drains for the first week or two. Since doing that, two key things. Number one, I have seen no seromas. That would be a fluid collection that occurs after the drain has been removed. And I believe that simply because the space is closed, the fluid would stay within the flap, which your body will absorb. Number two, I have seen nobody have bleeding. Now, although that's very rare, it can happen. And essentially, if the surgeon plans well, which your surgeon should do, you lift the skin up as you're sewing it back down. All of the blood vessels that you have cut on the way up, you sew closed on the way down. So you've essentially almost made it impossible for bleeding. So it takes about 30 minutes more to do. Doesn't cost any more, but I do think it is beneficial for most patients.